I was invited along with a group of other physicians, nurses, pharmacists by Dr. Ralph Jones. I found it very useful. I found it informative. I found it because I think polypharmacy is a problem in residential care. I found the information that was at the education session useful, particularly the algorithms. The other reason I found that the Shared Care Initiative was useful is that it wasn't directed just at physicians. It was meant for multi-professionals, including pharmacists, nurses, residential care coordinators. In my facility, yes, my RCC, which is my resident care coordinator, and Dr. Brody, who is my medical director, spoke about this initiative and how we could actually apply it to residents and use the process in Bradley Centre. Three months ago, we held two medication reviews, one by Dr. Ralph Jones and one by Dr. Brian Brody, where we reviewed all medications under a med review. At that time, with 90 residents, we reduced the medications by close to 200 medications across Bradley Centre. At this point in time, there has been very few medications that have been reinitiated, mostly antipsychotics and some respiratory drugs. But on the whole, we've found the process, looking at the statins, looking at hypertensive, looking at a number of drugs through the algorithmic piece around CSI to be extremely helpful. Residents feel better, costs are down, residents are not being, nursing staff is not being, spending all their time giving out pills. So as a long-term or as a short-term intervention, this has been really good. Whether it will hold true, whether we can maintain these gains, I won't be able to know for a year. Yes, anecdotally, the family members have said they're interested in this, they understand the process. Dr. Brody gave a lecture to, or not a lecture, he provided information to a number of family members. I think there was probably 14 family members there, and they were very interested, asked good questions, and yes, anecdotally, I think they found it very good and understood the reason for reducing polypharmacy in residential care. I do think it would be a good initiative to continue to assist us as we move forward, assisting in the process as we move forward. Continuing education, bringing up, providing this initiative in an education session for more physicians. The nursing staff, I think that's really important. I think also pharmacists would benefit from this whole process. And again, possibly bringing family members into the idea around polypharmacy. It's been an extremely good initiative for Chilliwack Hospital and Bradley Centre specifically. I think in residential care in general, polypharmacy is a problem, and I can give you a whole pile of reasons why polypharmacy is a problem.